for the kind introduction. Thank you for the invitation. There are over 12 million babies born thanks to IVF, but until 2025, nobody has ever seen implantation. And that shows how much there is yet to discover. That's a work of people in Barcelona producing a model of implantation. My name is Lewandowski, and today I'm going to talk about the device we patented in nOvum and how stable conditions of the embryo transfer can impact its outcome. This is my conflict of interest. This is our center. May I proudly present it. We've been doing IVF for over 32 years. So I started my IVF journey when I was 3 years old. And we have just under 27,000 pregnancies. We did most of the IVF procedures as the first center in Poland, and we tried to keep up the pace ever since, and hence the EmbryoPass. And I would like to keep it a little bit interactive, so if you could please raise your hand if you use ultrasound guidance for the transfer. Okay, 1, 2, 3, 4, no, just kidding. As you should, most of you did raise their hands. There's good evidence based on many RCTs that the ultrasound guidance does improve clinical pregnancy rate and live birth rate for the transfer. And now please raise your hand if you use soft catheters for the transfer. 2 days ago, we had a discussion what a soft catheter really is. Yeah, that's a tough one. I tried to search for a definition, but there was none. So if you could just, if you have any doubts, just close your eyes, imagine the catheter in your hand and try to assess if it's soft or hard. And those of you who did raise their hands had it right. Using soft catheter does improve the clinical pregnancy rate and live birth rates, although the data on the live birth rates are limited. Now, please raise your hand if you use bed rest, if you recommend bed rest after the transfer. One hand. American Society says there is good evidence not to recommend bed rest after the embryo transfer. Now, please raise your hand if you have music in the embryo transfer room. It's getting a little bit more interesting. Okay. There is a lot of research that the impact of music played during the embryo transfer does significantly reduce anxiety and stress of the patients, although it has no impact on the outcome. So maybe it's enough to reduce the stress of the patients, just playing music. The only harm you can do yourself is playing the music every day and listening to it on repeat, and then coming back home with playing like I have it with Wonderland by Simply Red. I hear it every day, and every time I go home, I'm just thinking I need to change this music in the embryo transfer room. Please raise your hand if you remove cervical mucus before the transfer. Less hands risen. American Society says there is fair evidence, although it's based on one RCT and one prospective cohort study, that there is benefit to removing cervical mucus before the transfer. So probably you should, if you don't. Now it's getting trickier. Please raise your hand if you have the catheter covered. So when the embryologist reaches you, that the catheter with the embryo inside is covered by anything, paper and hand, or maybe something different. Why does it matter? Those who did raise their hands had it right. Although it's not mentioned, neither by the American or the European Society, you can see the significant temperature drop inside the catheter when you do the transfer. Take a look at that. When you take 60 seconds from loading, you have 22 to 24 degrees inside the catheter. And also, time to transit and having the crib open or closed, so the catheter covered or not, does also significantly change the temperature inside it. And why does it matter? Because the pH of your medium is dependent on the temperature. And now, please raise your hand if you know your embryo transfer room temperature. Okay. some hands, interesting. There has been some research trying to find a correlation between the temperature outside or inside and the outcome of the transfer. There are not many evidence, and the evidence is not of the best quality, but for our center we did the research, and going below 24 degrees inside the embryo transfer room did significantly reduce our chances of having a clinical pregnancy. So probably you maybe should think about not going below 24 degrees. Not the best for your staff doing the embryo transfers, but still, maybe for the good cause. And now please raise your hand if you measure the injection time. So that you measure the time you take to inject the embryo into the uterus. 2, 3, 5 hands. Why does it matter? Because you can have a different kind of stress. You can have a work stress, you can have a conference stress, you can have a wife stress, and you can also have shear stress, which is the friction you have inside the fluid. It's very important in hemodynamics where the shear stress is exerted, or for example on the arteriosclerotic plaque, by the blood flow. And the same forces work on our embryos inside the catheter. And the American Society tries to say something about it, but it says that there's just insufficient evidence to recommend any specific injection speed. But don't let the EBM, evidence-based medicine, fool you. There's no way to have a specific injection time in the guidelines because the forces inside the catheter matter greatly on the diameter of the catheter, which we probably use in different shapes and sizes, as you can see here, and they matter greatly and depend greatly on the barrel diameter of your syringe. So we can have the same catheter, same diameter, but different syringe, and you're going to have different forces inside it. And the American Society says the ideal speed at which the embryo should be injected at the time of the embryo transfer is unknown, as this may be one of the most difficult aspects to quantify and thus compare. When I see something like that, I love to be the one to quantify and then thus compare. So that's what our research is about right now. And also, you have a computational model suggesting that the high injection speeds, if you push the embryo too fast, you can have an ectopic pregnancy, quite logical. But what is important to remember, not only you have the shear stress, so the let's say, inconvenient forces on your embryo on the way out, you also have them on your way in. And I searched for research about it, and I found only one study, which was called the PRED study from 2012, when they fixed a pump on lab table to load the catheter in a repeatable way. So here you can see the comparison between people and the pump loading. And you can see how much of a human factor there is in loading the embryo. And it's the same for injecting the embryo into the uterus as well. So, is there any hope for standardizing the unstandardized? We did the study 9 years ago. It's taken 9 years now. We took 2 doctors. They did 200 embryo transfers. We measured the time, the temperature. We measured the clinical pregnancy rate and the live birth rate. And then in phase 2, we measured the temperature drop inside the catheters. We had a special wire with a temperature at the end, so we placed it exactly in the spot where the embryo is, in between the air bubbles. We worked with Warsaw University of Technology to measure the difference in shear stress by injection time. And counterintuitively, if you have too slow injection speed, the shear force, the shear stress, is also bigger. So there is no room for mistake for a human. If you take it too slow, it's bad. If you take it too fast, it's bad. So we built a prototype we later called EmbryoPass. And we tested the device for repetitiveness, that it could load the catheter as we want, and that it's repeated time after time after time, and it's the same to exclude the human factor in the transfer, both in loading and injecting the embryo. Then we went and bought some sheep embryos. And if you think you have a tough job, take a look what it looks like to do a transfer to a sheep. We proved non-inferiority of the embryo transfer done by EmbryoPass to the sheep. And we have first sheep, EmbryoPass sheep born right now. We used UE money, we got a grant for it. And now it's phase 5 and 6 where we patented the EmbryoPass. We have a trademark for it. We got CE certificate, and we developed an EmbryoCase, which is a device to keep the temperature steady through all the procedure, not to have this this factor of the temperature dropping on the transit from lab to embryo transfer room. The clinical trial is registered as the EFFECT trial, and the use of EmbryoPass and EmbryoCase is human tested. And now the most interesting thing, this is what the EmbryoPass looks like and how it works. You take the catheter when it's ready to load, you connect it to the EmbryoPass. You have LED lights to guide you, and you have only 2 buttons, so it's very dummy-proof, just up and down. It's ready to take the air bubble now, and when the LED is flashing again, you should insert the catheter back inside the medium and take the embryo. Hopefully you can see the air bubble going up, so it's not a hoax. Then you take another air bubble and another piece of medium inside. And you're ready for the transfer. This is a dummy transfer done on Petri glass. You can see it being injected. And when the LED is flashing red, you're good to go and give back the catheter to your embryologist. And that is the EmbryoCase, which is holding 37.5 degrees Celsius inside. So we just place the EmbryoPass with the catheter inside it, and you can transit safely to the embryo transfer room. So to sum up, the non-standardized parameters matter greatly in the embryo transfer, and we try to compare the research, our clinics, and there is so much human factor in this procedure. The time to load the embryo matters, the medium volume, the time and distance from the lab to the embryo transfer room, the embryo transfer room temperature, the injection force, both the tempo and the time and the stability of the injection force. So as you can see, we now know that one thing matters, and that is everything. So we take the embryo out of the lab and we take it for a journey to an embryo transfer far, far away. And we must not forget that our embryos are under pressure. Thank you.